against coronavirus. Wear a mask in public. Stay at least 6 feet apart from others. And get tested. Join us and fight the spread. Visit scdhec.gov/COVID-19.
Hey, good Wednesday afternoon to you. I'm Trey Taylor, and you're watching Coping with COVID, updates on the pandemic and information to help you thrive and survive COVID-19. Coping with COVID and In It Together presents Well this Wednesday, and that's what we're doing today. And today, the launch of the In It Together website. We've got Michelle Harris with us, Communications and Resource Coordinator with DHEC, and Khristian Curry also joins us today. She's Provider and Engagement Coordinator for DHEC. And when we come back, we'll talk about the In It Together website. It's the hub, your go-to to help us all prevent diabetes, because we're in it together. That's coming up next on Coping with COVID. But first, our COVID community updates. The City of Columbia passed another ordinance yesterday aimed at curbing the spread of the COVID virus. This time, landlords are being urged to shut down house parties and large gatherings at apartment complexes. If they do not, fines could be imposed on the homeowners and their permits could be taken. Mayor Benjamin is concerned about the rise in COVID cases in other states with colleges and universities and wants to keep Columbia in bay. Council also requested the governor extend the 11 p.m. stop time on alcohol sales, and another curfew could be discussed again at a later date. Meanwhile, Charleston is beefing up their mask ordinance. Before, someone would get a warning if not wearing a mask in public. Now, no warning, just a fine. Anyone stopped on the streets of Charleston could get a $100 fine. Their names placed in a database, $200 for the second fine and $500 every time afterwards. Charleston officials say they are seeing more and more people not wearing masks or face coverings, including out of town and guests and tourists. And USC is welcoming students back with COVID tests, but not the ones that feel like your eyes are being groped out through your nose. The university is the first in the state to use the new saliva tests. All students, faculty, and staff on the Columbia campus can get tested beginning today and get results in 24 hours. Now, the saliva test is said to be easier, quicker, more efficient, more effective, and less expensive. It was developed by the College of Pharmacy students and researchers, including some from right here at the University of South Carolina. SCDHEC has your most up-to-date listings on times, locations, and dates of COVID testings in and around South Carolina. Go to scdhec.gov for more information. We've got some mobile testing sites scrolling at the bottom of the screen, but today you can get a COVID test through 3 o'clock in Lawrence at the Lawrence Exchange, and then until 6 o'clock this evening in Due West at Erskine Athletic Field. A couple of places tomorrow that you can get a COVID test from 8 until noon at the Pickens Recreation Department and Gagan Park in Somerville, also from 8 until 1 at Huger Community Center in Berkeley County and at Lexington Medical Center, from 8 until 2 in Florence at Cedar Towers, and then from 9 until 1 tomorrow at Saluda Baptist Church, Barnwell Health Department, Greenwood Medical Park, and Health Resource in Camden. Again, check the bottom of the screen throughout the show for more information on COVID testings in and around South Carolina. Also at the bottom of the screen, you can get information on the DHEC Care Line. You can give them a call for more information on not only COVID testing, but how you can get transportation to get a COVID test done. Do you want to organize a COVID test or screening in your community or at your event? That number is also screening at the bottom of the screen. And then don't forget about the free meal giveaways in the city of Columbia. They're doing this at several parks in and around Columbia, South Carolina, from 12:30 until 1:30 until August 28th. If you have got students age 18 and under, they can get a free meal, breakfast, lunch, and dinner every day. The Black Lives Matter mural petition is still taking signatures. Information to sign up for that is also scrolling at the bottom of the screen. Plus, the new Soul Survey. You may remember we talked to those folks yesterday. They're looking for African-American women and men especially. We need you guys from 18 to 65 for a 12-week program on eating, shopping, and living a healthier lifestyle. It includes a free weekly meal at Rare Variety Cafe. Go to newsoul.org for more information. As a matter of fact, we're going to be broadcasting live doing the show from Rare Variety Cafe Saturday at 2 o'clock, so don't forget to check that out. Mask Up Columbia, South Carolina, that's still going on too. Don't forget to head over to the Mask Up Columbia SC website. Take a creative picture of yourself in a mask, post it on the website, and you could win some cool prizes from maskupcolumbiasc.com. And finally, the City of Columbia Office of Business Opportunities is continuing their webinar webinar series, Operating Safely and Workforce Development, this time for construction. The webinar date is August 20th, and you can go to Eventbrite to get more information about that. I'm Trey Taylor, and Coping with COVID is brought to you by SCDHEC and In It Together. It's Wellness Wednesday, and we want to remind you to please head over to my personal and professional page, Taylor Made Productions. That's the home of Coping with COVID. Please like and follow. And then you can see Coping with COVID Monday through Saturday at 2 p.m. and also get all of your COVID-related updates. We're also streaming live on the In It Together website. So please like and share that information also so that you can get up-to-date information on In It Together. Speaking of In It Together, we're In It Together with Michelle Harris and also Khristian Curry joins us today. They are both from DHEC, and we're going to talk about that In It Together website. Ladies, thank you so much for joining us. We appreciate you.
No, thank you
for having us.
Absolutely. So first, for those who weren't with us last week, let's talk a little bit about what the initiative is. I know the website launches today, and we're going to get to that in just a few minutes, Michelle. But tell us exactly what In It Together is. What is the initiative?
So In It Together, Trey, really is the umbrella branding for the diabetes prevention efforts, diabetes prevention and management efforts that are going on in South Carolina. DHEC and a lot of other state level stakeholders are a part of coming together to not only pool resources, to share information, to work on strategy, to leverage the scientific, just human resources, everything that we can pull together. And so the reason why we call it In It Together versus just we're trying to prevent diabetes or something like that, because it not only are we sitting around the table in it together, all of the stakeholders, but everyone in South Carolina really is in it together because living a healthier lifestyle affects everyone. That's something that everyone should strive for. And what we're trying to do is let people understand you are never by yourself.
Right.
If you're getting, if your doctor is telling you you have pre-diabetes or diabetes, the first thing you may think of is, oh my gosh, what do I do next?
That's just, right.
Even though you know other people have the condition, it's affecting you now. So what we want people to understand is that we all play a role in this. Not only the physicians, not only the employers who provide the health insurance, not only public health professionals like the folks at DHEC, not only community level people who are doing outreach and support, but also people within the family. The moms and pops who are cooking and shopping and helping the children. The young people play a role. So that's the reason why that was the real spark with the whole In It Together movement, so that people could never feel alone and that there's always someone or something they can connect to get more information.
You know, Michelle, I love that because you're right. It takes a village to raise a diabetic. You know what I'm saying?
Okay.
You know, because it absolutely has everything to do with everybody in the family. If everybody is not first on board supporting you, then you're not going to, it's going to be harder to conquer it.
And you're true. And you're right. Not only supporting you, but even recognizing it, because we talk about that a lot. I mean, DAC, or Diabetes Advisory Council of South Carolina, we nicknamed DAC. When I started working with that years ago, the focus was on getting people to recognize that prediabetes is a thing. Okay.
Yes.
Prediabetes is not a bump in the road to diabetes. Prediabetes is a thing in and of itself, an elevated A1C.
So pre-diabetes is really diabetes.
Well, it's the condition that it's the diabetes adjacent. Let's put it that way.
Right. Yeah.
So that's the thing that I want people to understand. If your doctor or your healthcare provider has told you that you have prediabetes, you do not have diabetes. What you have is prediabetes, which is an elevated blood sugar. But many times people are like, whoo, dodge that bullet. At least I don't have diabetes. But we're trying to get people to understand, no, prediabetes is something that does need to be, the attention needs to be addressed.
Maintained,
Yeah, you do have to pay attention to it and work with it. And so, you mentioned absolutely the entire family is on board. Last week, because, I watch you all, but last week we were talking with Dr. Wilson and with Shauna Hicks from DHEC. We're talking about the fact that, it's not going to be, it's your healthy diet. Here's your apple while I sit back and eat apple pie.
Right. That's right.
And I'm from the time when, we're not doing two separate shopping trips and two separate shopping lists and stuff like that.
You eat what's being served.
Yeah. And I remember years ago, because Trey and I, full disclosure, have known each other for years. But years ago, J. Anthony Brown, who I know is working with you on the show, has been very open about his diabetes, which is, that's commendable. He said, which is true. He said there's really no such thing as a diabetic diet in the sense that here's what diabetics can eat and the rest of us can go have a bunch of cheeseburgers. He was saying if everybody ate already like they had a diagnosis of, in this case, prediabetes or diabetes, then we could make such a dent in people never progressing along that spectrum.
Yeah, because it's so much more than diabetes. It's diabetes, it's heart disease, it's being overweight, it's hypertension, it's it's letter D, it's all of the above, So we really need to be more conscientious. The other thing is that it is also important for people to have relationships with their physicians, with all of their healthcare providers, which their coaches, Khristian, whoever they need to help maintain their numbers, to help maintain their health, because there's so many facets, there's so many arms to living a healthy lifestyle. So that's what I love about the website, because it has so many different tentacles. It's such a resource. Right. It's so much one-stop shopping, so to speak, for people to get it together and help manage your diabetes. And again, whether you are diabetic or pre-diabetic, as you said, that just means one more trip to Krispy Kreme and you could be diabetic. So, if you don't pass that hot sign, you're doomed. So you've got to be conscientious about it, but you don't have to do it alone. You don't have to do it alone. And that's what I love about the In It Together concept.
And you're right. And I was glad that you mentioned with Khristian, with the lifestyle coaches, because Khristian she has an exciting announcement on her end about some advanced training or some additional training for our lifestyle coaches. But that's why the programs like the diabetes prevention programs are called lifestyle change programs, not lose some weight programs or programs or whatever people might think they are, exercise programs. They're called lifestyle change because your lifestyle really has to be very different. How you shop, how you cook, how you think about food, how you entertain, how you celebrate, what do you do when you get depressed? Because now you can't get the half pint of ice cream. Right. And you're talking about, and I'll speak from my own experience, you're talking about a lifetime of bad habits that have to be.
That's right.
So I got to rewire my brain when it comes to, okay, now you see the Snickers bar, keep walking, that type of thing. And so the lifestyle coaches are just fundamental. You've had several of them on your program before, and you see that they're very caring people out in the community. Some are medical professionals, some are come from community-based programs, and they're just like, I want to help people along the way. I want to hold hands. I want to share information, and I want to be in the struggle with you. So it's not me preaching at you, it's me being in the struggle with you.
Yeah, and it is a challenge. I mean, anytime you try to change something, as you say, that has been habitual, that you've done most of your life, that your mama and your daddy did, that all of your siblings and your cousins did, we talk about families and family gatherings, and that's where food lives, and at a family gathering, and that is also where our history of diseases. And sometimes I think as a people, and I can only speak for being African-American because that's all God bless me to be right now. Another day I might be something else, but I can just talk about that, is that we tend to look over the fact that grandma has diabetes and had diabetes, and every one of her siblings had diabetes, and it's just par for the course, or that everybody is overweight, or that you just keep pushing cake in front of you. It's almost like, oh, that's just a way of life. It's, this is a different thing, but it's almost like poverty. It's just like, oh, this is just how we were raised. This is just how we gonna be. Right. This is just how it is, while our family members are dropping left and right. And we're talking about now, we're in the midst of COVID, where African Americans are at greater risk because of all of the pre-existing conditions. And if you name them, we got them. So,
Right.
you know, and then we wonder, go ahead.
No, we didn't just get in trouble. It's not like you say, it wasn't that COVID caused something to happen with us.
That's right.
These disease states were already there. And really, we kind of made some accommodations for a lot of that, where and I remember having a conversation with my sister where she was talking about how her husband, it could be so frustrating, where when he got a diabetes diagnosis, he did not recognize that does mean that you have to keep on driving past that Krispy Kreme hot light sign.
Yeah.
You know?
Yeah.
He honestly didn't make the connection. He's an intelligent man, but he thought, so I'll work on that diabetes. Now I'm gonna just go ahead and eat these donuts and that second plate and everything else. And he just didn't get the connection. And I think a lot of people don't. We can know grandmama has diabetes, but we still gonna put another cup of sugar in this sweet tea, to make it for dinner.
Right. And not only give it to her, but we're going to drink it ourselves and give it to the babies.
Exactly.
And then the other thing is, and Khristian, feel free to, jump rope with me and Michelle, because we can sit here and do double dutch all day. But if you can, look, girl, get in if you can. But the other thing is that, so even if we're on medication, that's the other thing. Right. When you're on medication, yes, that is controlling the condition, diabetes in this case, but that doesn't mean now you still have an open door to eat whatever you want to because I'm on medication.
Well, absolutely. And in fact, the medication in and of itself, and this is no indictment of Big Pharma, I'm not saying that, but the medication itself, as you know, with a lot of the legalities now, if you notice the commercials, we've enjoyed 50 seconds of the pharmaceutical commercial, and now we have 10 seconds of, and this could cause this.
Yeah.
That's the part that gets me. We're going to stop you from itching and this, and death. And I'm going, do I really want to die because I'm trying to take this antihistamine? But yet you're right. We begin to think, okay, well, the doctor gave me, 5 different medications, and I've got my little pill sorter every day, and I am definitely not anti-medication. Like we talked about, the healthcare provider, if your doctor is giving you something that is helping to control this condition, to help control your blood sugar, yes, control your hypertension, all of that, I am not saying, we'll just throw that out. Take it and take it directed, please.
Yeah.
But it does not mean that now this is a lifetime prescription for the rest of my life. Or here's the other thing that amazingly, I don't think people realize, it doesn't fix the condition.
Right. It's still there. You're still diabetic.
Right. You're still hypertensive. You're still, and so if we're masking these things or we're treating the symptoms, we do have to look at, and I'll tell you from my own standpoint, sometimes you think though, but what can I do? And that's where we go back to using the healthy habits, the healthy eating and the active living to treat the root cause of some of these chronic conditions.
And prevent too. The emphasis is on prevention. So if we can, stop it before we get to the point where we need medication, that would be the goal ultimately. And then that also links back to the comorbidities that we talked about. We often don't see just one chronic illness. We see overlapping chronic illnesses. Right.
Yeah, that's Khristian Curry, provider engagement coordinator. Michelle and I allowed her to say something just for a moment.
Good job.
Good job, Khristian. You get in there, girl. Also, Michelle Harris joins us. She's a communications and resource coordinator with DHEC. We're talking about the In It Together website launch, and we're going to get to that in just a minute. But right now, we're just having an open, honest, frank conversation about diabetes and other health concerns that particularly in the African American community, it plagues us, and we have got to take a grip on these things, because the other thing you mentioned, Michelle, is not only do we really want to be taking medicines all of our lives, but don't we want a better quality of life? Don't you love your children or your grandchildren or the man or woman in your life enough to want to go to the park or go to the beach or run outside? I mean, I was outside playing Frisbee with a 2-year-old and a 4-year-old yesterday. Thankful that, girl, what? And just glad that I did for a minute. I just said, you know what, God, I thank you that I am able and in
Well,
good health enough to run around or not have to sit on the porch and watch them run,
right,
but
right.
I'm able to do it. So we've got to do it for our quality of life.
That's it. And I'm glad that Khristian mentioned prevention, because see, she and I are kind of at two different places in life where certain chronic conditions are at my doorstep, or my doctor's like, sit down, we got to talk, you know, but Khristian is absolutely right about the fact that you don't want to get to the doorstep of disease to decide, well, I better do something. So, so when we're talking about taking care of ourselves when we're young, and many times, again, that's the time that you're going through the fast food line, or you're doing whatever, because your body's almost taking care of, in your mind, it's taking care of itself. I'm staying in the same size jeans, or, you know, I'm feeling good because I'm out playing or running around all the time anyway. But at some point it does take a turn. So, and here's the thing, you can't wait for the outward expression of it.
Right.
Your heart, your cholesterol. We're seeing type 2 diabetes in children now.
Right, exactly.
It's almost unheard of. And the last time I checked, you know, the 8-year-old doesn't go to the grocery store on their own. So they're getting the food from adults. And
that's right. That's right.
And not an indictment, because again, we've talked about the fact that if you're on a tight budget, I mean, Cheetos is going to last you 6 months, and that, you know, those bananas, after about 4 days, I'm starting to see splotches, and we might have a problem. So we have to learn ourselves a new way, and then we have to teach that and pass it on.
Yeah, we absolutely do. We're talking to Michelle Harris with DHEC, and also Khristian Curry with DHEC about the DAC and In It Together launch and website. It's called In It Together because it takes everyone to come together to help those folks who have diabetes. And as Khristian said, pre-diabetes, because like you said, Khristian and Michelle co-signed that if you are diagnosed as being pre-diabetic, you've got a chance to turn that around. You've got a chance to turn it around. And it's not only for you and for your health, it's for your well-being, your peace of mind, your quality of life. And when other things like COVID hit, you're not, you know, on the front line, so to speak, of it, you know, affecting you first.
Well, right. It does. You don't have those things that at that point, by the time COVID hit, you know, we're at the point of on that downward hill on the roller coaster where you better just hang on, because at this point, trying to turn your diabetes around or something like that, you're at a point where you're now you've exposed yourself to risk. Yeah. So, and I do want to mention, because you mentioned about pre-diabetes and turning around, I've even had a physician talk about the fact that if you have been diagnosed with diabetes, you can still live a healthy lifestyle.
Absolutely. Absolutely.
You can do the things you need to do and get your blood sugar back into normal ranges by you know, healthy lifestyle choices. And that's something, though, it takes an overhaul. But I think sometimes people have this fatalistic of, oh, well, I didn't catch it before, so I'm in it now. But there are things that you can do that will allow you for your body to function so much better, even if you've been diagnosed with a chronic condition.
Right, Michelle. I think it goes back to prevention is the goal, right? But lifestyle change can be beneficial after a diagnosis, and there are still benefits to lifestyle changes after you reach the threshold of those chronic diseases.
Yeah, absolutely. I mean, and, you know, Michelle, you shared, you know, some personal things. I'll share mine, you know, and I said this to Dr. Wilson when he was on, he and Shauna last week, you know, every generation of women in my family had diabetes. I mean, I just knew that, you know, you just know that growing up. And I remember growing up, that little coffee table of peppermint in the living room. When their sugar went low, they had to eat a little peppermint. I never understood that. Dr. Wilson explained that to me. I didn't understand if you got sugar, why you eating sugar, but I digress. But then so it skipped me and got my brother. My brother was the first and only so far a man in the family that has it. But I always knew I had to be conscientious because it is hereditary. And that's the other thing that doesn't seem so fair, because here I am exercising, eating right, but because, you know, my family has heart disease, diabetes, breast cancer, I could too, because of all these other things, you know.
But you know what? Just like was said last week, those same genes that expose you to that are the same genes as to why you still looking like a teenager and getting on my nerves with that. So
Yes.
I mean, there are good things and bad things. The same genes as to why you can sing so well and you're so intelligent. So it's like the formula that we're dealt, it might expose us to certain things, but it also gives us so much, you know? So
Yeah.
I look at it and I'm completely transparent at this point. I'm just an open window, but I do have diabetes runs in my family as well. And my father was diabetic and in fact died from complications of diabetes at the age of 42. I was 18 years old. And here I was, headed to college. And so I know what it feels like. That's my why for why I work in diabetes.
Yes.
Because I know what it feels like to get married and not have my father walk me down the aisle, to have him not be there to hold that first grandchild, to, so many things that he could have taught me that he wanted to, but he wasn't here to share. And just like you were saying, sometimes even if you're here, if you're a shell of yourself where you're not mobile or you're not feeling well,
That's right.
You still are not there, able to be there for those special moments.
That's right.
But yet, even with again, you can know better. I have that example myself, and yet it's still a struggle for me,
And it happens, because like I said, about 3 years ago, I was diagnosed as being pre-diabetic. And again, here I am, vegetarian, eating right. Now I do love my chocolate chip cookies. Okay. But I was pre-diabetic and I was freaked out. I was like, I will not take medicine. I just do not want to do it. And then ended up, as you know, having, Khristian, I had a problem with my voice. I thought that I was having some allergy problems because I was hoarse every day for several days in 2018. Ended up finding out that I had a problem with producing too much acid, and the acid was going up, searing off my vocal cord. Anyway, they wanted to prescribe medicine. I said, no, what else can I do? Lifestyle change. I had to stop eating acidics. So that's any lemon, lime, tomato, just think of how much is made with tomato paste. Chocolate. Oh my God, that meant I'm gonna have to stop eating chocolate chip cookies. Fried food.
I would need some counseling. Yeah.
Look, fried food, girl, I love me some French fries. I love potatoes, baked potatoes, French fries, potato chips, whatever. But you know what? I said, I'm going to do this because I need to do this for me. And I did it so my voice wouldn't be hoarse. Consequently, I did lose 3. I was in a size 8. Now I won't tell you what I am now, but I lost 3 dress sizes and I am no longer pre-diabetic. So you can turn it around. I mean, now that was extreme. I was pretty much eating nothing but asparagus and drinking water, but
but your body can, disease conditions or disease states can reverse themselves.
And then after that, I was able to go to eat some fries. I love Zaxby's. I could eat once a week. I give myself a treat or something like that. But it can happen. And that's the point that Khristian, you and Michelle were saying, is that if you decide to make that commitment for yourself, for your life, for your loved ones, you can turn it around. So the In It Together website is an excellent resource for people to get the resources and the information they need so that it can happen. I want to say hi to everyone that has joined us on our Coping with COVID and In It Together Presents Wellness Wednesday. We're here talking about the In It Together website launch. And coming up, we're going to kind of walk you through the website. Michelle's going to tell us about all of the features, and then we're going to talk to Khristian. Mitchell Peace Joy Jen says, people have to make lifestyle changes. They also have to have a mindset change. Absolutely.
Yes.
Absolutely.
And really, it's kind of flipped. You have to have the mindset change, then you can make the lifestyle change. At least if you want it to be lasting, because you're talking to a person who yo-yo up and down dieter. So you can change the physical, but it's always going to go back to where your mind is. And this is the discussion that I'm having with myself about making sure, because I'm like you, Trey, it's just something about being on prescription medication. It's something about being labeled as having a chronic condition that it was maddening to me. And so I am looking at and moving towards, and it's a process, because it's not all I'm going to go in the pantry and throw out everything.
Exactly.
It's a process of wanting, not just having the foods, but wanting those foods. I will tell anybody, I can do better with my eating. The part that gets me is exercise. Now, if I can get the exercise van to come to me, I have to go out and down. I'm like, oh boy. So, but that's a mindset change. I mean, Khristian and Khristian can really talk to you too about kind of some of the things, even in COVID, being kind of restricted as far as where you normally go, what you normally do. But Khristian, what are some of the things that you're doing that even contribute to your mental and your physical health while we're socially distancing?
Yeah, so I'm trained as a health coach, and part of the curriculum for health coaching is the mindset shift. So that's realizing you have autonomy, you have control over your process. So, and that kind of goes against the traditional medicine framework where you go to the doctor, take the medicine.
Yeah.
Do.
Yeah. I know that Khristian has been listening to podcasts and stuff like that while you're walking. And do you get out early? Because that's my biggest thing.
I try to get out early because it is hot out there. So I try to get out.
Or you can do it late. You can do it late, right before the sun goes down. And I'm a big walker. And I'll tell you two things. I love to walk. Now, I'm not, I'm not going to be jumping up and down. I got too much happening in the top of my, I can't be just jumping up and down, if you know what I'm saying.
Yes, I do.
I'm not doing all that. Knock myself out, give myself a concussion. I'm not doing that. But I love to dance. I love to walk. And you're right, Khristian, early in the morning, I'll tell you, I had to stop walking early in the morning because I, caring for a little one, so I can't do that. But late in the evening, I'll walk with them, have them walk. And now, of course, I can't walk as fast with them, but you're outside, you're walking. I've got one of those ab roller things, you can do that. I have a stationary bike, you can do that. Walking up and down stairs. I'm telling people what parking further along, there are things that you can do. We're actually going to talk, because I want to talk a little bit about that more, Khristian, when we come back, just giving some people some tips. You said it's a mindset change, what people can do, not only to change their mindset, but then to activate it. And then we're also going to come back and actually look at the website. And Michelle is going to walk us through that. It's Michelle Harris, Communications and Resource Coordinator with SCDHEC, and Khristian Curry, Provider Engagement and Coordinator. We're talking today about the In It Together website. It's an amazing resource. And coming up, we're going to tell you about it, show you about it, and also get you the information that you need. That and more coming up next on Coping with COVID. I'm Trey Taylor. Coping with COVID is brought to you by the South Carolina Department of Health and Environmental Control. Visit scdhec.gov for an updated list of testing sites and important information on how to protect yourself, your family, and friends from the coronavirus. SCDHEC, healthy people, healthy communities. Also, the City of Columbia Office of Business Opportunities, helping to meet the needs of small, minority, and women-owned businesses in the City of Columbia. Log on to columbiasc.net/OBO. Agape Counseling and Training Center. Call 803-779-2777 for licensed professionals of counselors and social workers helping families, engaged and married couples, and individuals of all ages gain an understanding of all aspects of their life. If you're having a challenge coping with COVID, contact Agape Counseling and Training Center at agapects.com. And Columbia Housing Authority. The agency is looking for stories from former residents of Allen Benedict Court to retain some of the property's rich history. In its 80-year life, Allen Benedict Court has been home to some of the country's elite, including a Grammy Award-winning performer, corporate executives, national television celebrities, a host of doctors, lawyers, and NBA greats. So share your pictures, mementos, and memories at chcares@chasc.org. Coping with COVID, brought to you by the South Carolina Department of Health and Environmental Control, the City of Columbia Office of Business Opportunities, Columbia Housing Authority, Agape Counseling and Training Center, and Palmetto Media Connection.
Coping with COVID with Trey Taylor.
Hey, thank you for joining us again for Coping with COVID. I am Trey Taylor. It's brought to you by SCDHEC. In It Together. It's a collaboration to bring you Wellness Wednesday every Wednesday. And today, Khristian Curry joins us, provider engagement and coordinator with DHEC, and then Michelle Harris, communications and resource coordinator. And today is the day of the In It Together website. Now, I know you guys have a Facebook page also, Michelle.
Yes.
If we can get that graphic up for the Facebook page, we can look at that a little bit, and then you can kind of tell us a little bit about the Facebook page first before we go to the website. Can we get there?
Sure,
you go.
sure. And you'll see, it's In It Together SC, okay? Because if you search In It Together on Facebook or any place else, you'll see quite a few things that come up because it is kind of a broad message. But In It Together SC will get you right to the Facebook page. And the purpose of the Facebook page is because, number one, social media is where a lot of people are having conversations. So that's where we need to be as well.
Absolutely.
You can find out more information about what we're doing, if we're recruiting for certain classes, that sort of thing. But also, and COVID has really brought this opportunity to us, what we're going to be doing is having our In It Together diabetes prevention programs. They can be conducted or at least supported virtually through our Facebook page. We have a young lady, Tiara Rosemond, who will be on next week talking more about the Facebook page. She will help people through it. Many times, especially if you have a smaller or community-based site, you don't necessarily have someone who's saying, I don't know if I want to manage my own Facebook page and all of that. But it is a resource though. So that's where we can, the In It Together Facebook page, In It Together SC, can help you come under that umbrella. Tiara will be able to be there to help you. You'll have access to resources. You can advertise things that you're doing.
Oh, that's good.
Yeah, Facebook has, come up with the rooms and different ways that you can meet privately with your group. I mean, there's a lot that can be done. So we are super excited about having that digital presence on Facebook. And again, while you're sitting there scrolling, a lot of times people are just relaxing and scrolling through Facebook. So one of the things that's helpful is this is something that gives you credible information, and it gives you something that could be life-saving. I mean, you can, as many times as people hit like and share, by all means.
That's right. That's right.
Yeah. So get the updates, In It Together SC on Facebook. And then, like I said, this is an exclusive, Trey, because actually the very first time that we have put out the web address, inittogethersc.org, is right here on your show.
Awesome.
Yeah. So, and we have been working on this for a while, the Diabetes Advisory Council of South Carolina. So if you hear us say DAC, that's what we're talking about. And that's that body that has come together with all these folks who are have all of these great efforts to either prevent or manage diabetes, to bring people resources. So we have heard from a chorus of voices about what do we need that could be a resource. I go back to where COVID has hit us hard, but COVID has also given people an opportunity to live on a digital landscape. So more importantly, even than before, to have this one hub that you can go to that again connects you to wherever you need to go. It'll connect you if you would like to join DAC. It connects you if you're a doctor and you want to refer people to a Together diabetes prevention program. If you have diabetes and you're trying to find a support program for you, we can do all that. So DAC is the DAC website is a one-stop shop. So the inittogethersc.org is just a one-stop shop, and it's a great resource, really.
Okay, so can we bring up the website and let's kind of go through it a little bit? We're going to bring the website up, and then Michelle's going to kind of take us through it. I love, Michelle, that you say, because we are such a share society, hit and share, hit and post. If people see something that that's good on that website or on the Facebook page, they can share it out to their friends and their contacts, because again, you never know who may need the information. All right, so this is the inittogethersc.org, right?
Right. And this is the landing page. If you go to the page, this is the first thing you'll see. And, it's important because even the imagery, it was important to have real looking folks, not somebody who's a size 2. I'm not hating on anybody who's a size 2, but sometimes you want to see some folks that's like, okay, yeah, I think that's so reflective of me. I like that.
Right.
And, it just gives you that basic, great positive message, and the fact that it's brought to you by the Diabetes Advisory Council of South Carolina. So just reminding people who's bringing it to you. But as you scroll down, you will see all sorts of positive messaging that really tell you are not alone.
Right.
Of course,
that's
we
good.
we would not be DHEC. We would not have physicians on hand if we didn't have certain stats. But it's telling you, this is giving you some basic information about diabetes, pre-diabetes in the state. How much is it costing you? What is it? I mean, how many people have it? How many people don't know they have it? That sort of thing. And if we could go right back to the part with the map, if we could scroll back up, because that's a great, where it says find a National Diabetes Prevention Program. If we could go back to that map, that's where, if you're wondering, I'm in the state, I'm right there. That's it. That's a live map. You'll see the different colors and the different regions of the state, upstate, right. So you see how it's if you say, oh, I'm in the Midlands, or I'm in the upstate, you go ahead and click on that. And then once you do that, it'll bring you to a page where you can find your county and you can filter out, let me find a program that is a diabetes prevention program near me. And
that's good.
In light of COVID, and we have lots of them. And I'll tell you, this is information that you can find on the CDC website as well, but this is a lot more user-friendly, trust me, because CDC has to deal with everybody in the country. So we're just dealing with South Carolina, and this does that for you. And we have, and just in case you're wondering, we do have providers who have continued to provide or continue to implement during COVID. So they're getting on Zoom calls, they're doing conference calls. They're, like I said, we'll soon have the Facebook page for them to go with. And I mean, so people are making it work, even in the midst of COVID. And if we go on down on this page, there's some great things in store. So even though we've got this great comprehensive site, there's always going to be new things that you can go to. So when you want to get involved, okay, you are fired up and ready to go. And so if you are an organization or you have a business or something like that, and you want to start a diabetes prevention program, you can click on that icon there. In the news, that's going to be a place that people are going to go often, because we are going to start archiving all of the Coping with COVID In It Together segments. So they will be there, as well as other resources. We have lots of great partners, including DHEC, including CDC. We have lots of great resources that will bring you things about healthy eating, active living. We're going to do some extensive original programming with you, Trey. So we're thrilled about this partnership.
Yeah.
And
Thank you.
all of that is there as well. So it's kind of all a one-stop shop. And then if you are a physician, you're a healthcare provider, and you want to refer someone because you're just like, yes, I know that this is out there and I want people to get to it, you can click on that icon. That will take you so that you can refer someone, which is great. And if you go up to the menu at the top, so it's really easy to navigate, very user-friendly, which we like. So if you go to that main menu, that For Your Health tab, that is really where we want people to start, because that gives you some basic, if you're an individual, that's where we want you to start, to get some basic foundational information about what is healthy for you. If you scroll through it, you'll see that we're giving you a good relaxing read as far as what we want. Now, if you can jump right to it, if you want to know your risk.
Access your risk,
Yeah, when you're talking about knowing your risk, we're talking about a few simple questions to let you know, without a blood test, am I at risk of prediabetes? Do I have, so that assess your risk button will take you to the CDC website. It's like a few, just click survey questions, and it will let you know, hey, you might want to talk to your healthcare provider, or hey, you're looking pretty good. So these are the things, because what do you say, when you know better, you do better. So
supposed to,
we've got those. And like Khristian talked about preventing disease. So we're talking about preventing diabetes. So that's giving you some basic overview, foundational information. And then if you scroll down a little further, I'm gonna tell you, like we talked about, where we're in it together, because if you have diabetes, like I say, we get you all the stats with the 5 to 7% and the healthy eating and the active living and all of that good stuff. Manage diabetes. That's the part that I wanted to get to, because you and I both have already shared, Trey, that diabetes touches our families. Frankly, I don't know anybody that doesn't know somebody that has diabetes. So you might feel like you're swimming in a sea all by yourself, but you're not. So we have this information here. You'll see that hyperlink to the American Diabetes Association website, which has a wealth of resources to give you that. So that's absolutely wonderful. And then if you go on down to the bottom of the page, unless that is the bottom of the page. There we go. Oh, no, there we go. I was about to say, now this is an excellent one too, because just like on the other page, we had where you could find a diabetes prevention program. This will allow you to find a diabetes self-management education program.
Mhm.
And that's super important because, again, we're talking about a lifestyle change, a mindset change. And while I can think about, yes, I know I have the desire to do it, I do. And people who have been diagnosed with diabetes, not only are we talking about something to eat and how you move around, but there are other things that you have to do for your health. There's
Right.
new technology, that talks about insulin and taking your insulin and taking your blood sugar levels. There's also checking your feet, wound care.
Yeah.
These things are very important. So it's more than just knowing that I should eat differently. It's definitely about other things that you need to do to monitor your health. So that's absolutely important.
All right.
And then if you go on down, and just like I said, we just want to just explore the whole website. Oh, that's right, going up to the top. That's it. We have this outline. We have so many pages on it, so much information, which is great.
Yeah, and this is inittogethersc.org. Just for if you just joined us, want to thank everyone for joining us on Coping with COVID. Courtney Brightheart says hello. Hey there, Courtney. Thanks for joining us. We are looking at the inittogethersc.org website, where you can get countless resources to help manage your diabetes. Michelle Harris with DHEC is kind of walking us through it. So go ahead, Michelle.
Well, thank you, Trey, for that, because we do want people to know that exactly where we're going. Now, the tab that talks about for healthcare providers, we did have, and I did want to speak to this, we did have Dr. Patricia Witherspoon, who would, there's a whole toolkit for healthcare providers. So by all means, go and check that out. She was going to join us today. She had an emergency, but she did ask for a rain check to come back.
Absolutely.
We could talk about that because, again, just like we had talked about, Trey, before, not only did the general public not necessarily understand that prediabetes was a thing, it's a transition. I mean, it's a whole shift for healthcare providers to seriously talk to their folks about it, to let people understand and not just tell you that you have prediabetes, but what you can do about it. So that's where peer-to-peer physicians and healthcare providers are talking to each other. So I look forward to the visit coming back with Dr. Witherspoon.
Absolutely. Yeah.
And then if you go back to the main menu, here's coming up to Khristian's part about, there is a part that talks about employers and insurers. And I don't want to leave that out because the business community, super important for what we are doing. It is so important. If you go back to that main menu where it talks about for employers and insurers, and that's part of where DAC's collective action comes in as well, because we have major employers who are sitting at the table, major insurers who are sitting at the table, because here's the reality of it, especially in the medical profession. If you don't put the money behind the prevention programs, the testing, the all of that, it's not going to be sustainable.
Right.
Just because, I'm not begrudging our healthcare professionals. When they talk to us about something, they need to get paid to be able to keep it. So when insurance companies start covering it as a benefit, these preventive programs, these lifestyle change programs, when employers start offering it, many of them offer it on their work site, offer it as an added bonus to their employees, things like that. So insurers and employers are super important for you to be able to go and calculate it when you're doing your healthcare plan. But we definitely need you at the table. But yeah, I wanted to make sure I was excited to get to Khristian's part. If you go back to the main menu about the coaches circle, that's an exciting part. It's not talking about baseball or anything like that. It's talking about Khristian can take that.
So this is the coaches circle. Khristian, can you tell us what this is? Tell us about that.
Yeah, so the Coaches Circle is a community, it's a learning community for lifestyle change coaches, specifically for coaches practicing here in South Carolina and who are delivering the diabetes prevention program.
All right, and so what is a lifestyle change coach? What is that?
So a lifestyle change coach is someone who is trained to lead the National Diabetes Prevention Program classes. These are in group settings, and they are there to really encourage and support people who are trying to either prevent or delay type 2 diabetes. So they go through a training. So you are trained through a CDC approved entity. You can be trained in person with a 3-day training, or you can go through virtual trainings to get the certification. And after that, you get all of the curriculum, all of the information to deliver the courses in the community. And they can be delivered in a variety of settings and by coaches from a variety of backgrounds. We have coaches who are like lay health workers, and then up to nurses and pharmacists. So a wide variety there.
Why would someone why would it be beneficial for someone to join the coaches circle?
Yeah, so like Michelle spoke to earlier, and to our theme, the In It Together theme, we want coaches to feel like they have a community within themselves. So they spend so much of their time fostering community within their cohorts, the people who go through the program. We want them to feel supported. So really the benefit to joining would be to have that support system, but also to have some more practical benefits as well. So we're developing a digital platform where the coaches can connect with one another and share, and also get access to all of the resources and events that we're sharing. We plan on having virtual events this year, and whenever we get back to our new normal and we can do in-person events again, we want to do that. We get our hands on a lot of we call them lifestyle change support items. So these are things like scales or recipe books or anything like that will help support lifestyle coaches. So we get those and we give those out as well, in addition to printed and digital resources, and then other professional development opportunities.
So are you actively recruiting coaches to become lifestyle change coaches with the In It Together DAC program?
Well, right now, correct me if I'm wrong, Michelle, but I don't think that we're necessarily recruiting them to become trained, but we do want the coaches who are already trained to take advantage of this resource.
And we do have, and you're correct about that as far as what DAC is doing. However, if somebody has a burning desire to be trained, under the DAC umbrella are organizations who are recruiting and training and working with folks. So if you're already trained, we want to hear from you. It doesn't matter if you're not currently teaching a class. If you have been trained, because we have so many people who want to get reconnected, and perhaps the organization that they worked for is no longer implementing. But if you've been trained, come on back home. We want you.
Okay.
And we want to put you back in the circle. And if you do desire to get trained, we can connect you while we're not doing the training ourselves. We can find you somebody who is cultivating coaches and training.
And then for the general public, can they kind of come to the Coaches Circle page to find out about upcoming events and things of that?
Yeah, so we'll definitely have things like news and upcoming events. We actually have a training coming up on August 28th. It's a day-long training from 8 a.m. to 5 p.m. and it's hosted in conjunction and in partnership with UNCG Health Coaching Program. So health coaching as a profession really has some skills and toolkits that are transferable to lifestyle change coaches. So it's a free training for people who are trained NDPP coaches in South Carolina. It's virtual. And we'll be covering topics like coach communication skills. So that goes from anything from active listening, motivational interviewing, to positive psychology concepts. And then we'll also be going over some of those coaching fundamentals like, setting the coaching relationship, setting agreements, and establishing accountability, and then also facilitation skills, because we can always develop those skills to help facilitate the group setting. So we have some space is limited, but we do have some open spots. So if you go to our website, you'll see this flyer and you can click the register now, and that'll link you to our Eventbrite registration page.
And this is on the inittogethersc.org website.
Yes.
Okay, so folks can go to inittogethersc.org and get a virtual training August 28th, as the flyer said, and Khristian mentioned. I want to say hi to Mitchell Peace Joy Jen. She says having eye exams are important also. Absolutely. Michelle. And then Sierra wants to know about signing up for a coach. Can you sign up for a specific coach? Or can you sign up for a coach if you participate in the program?
So I think if you go back to the map Michelle was mentioning earlier, that's how you can find an NDPP program, correct,
Okay.
Michelle?
Oh, right. If you're looking for a coach, if you're looking for a program, definitely go back to the where you can sign up for a program and give you the whole list.
Okay.
But if you would like to, and I'm not sure if Sierra was asking if you want to sign up to be a coach, like I was saying, that's where we could, because even on the CDC website are resources on how to become a lifestyle coach. The main thing for what Khristian is doing and what we're doing right now is that for so long, these wonderful giving folks have been out kind of on their own or within their own organizations. So we're trying to bring them together, get that synergy going, get that support system going. So yeah, if you've been trained as a lifestyle coach at some point, we want you to come back in and get together. This Coaches Circle is really a place for you. Yeah, technically the public could go to it, but this is really your special place.
Okay. Okay.
Okay, I'm looking for people like me. So that's where that is. Yeah.
Right. All right. So it's in it together, sc.org. As Michelle and Khristian said, it's just an amazing hub, one-stop shopping, so to speak, for physicians, healthcare providers, for those who are dealing with diabetes themselves to come together and get what they need. Because as you said, Michelle, we're in it together, and it's a great support system. It's just an amazing support system. So it's live now. It went live today. It's all the way live, as the song says.
Right. And by the way, if you're an organization or a business or an entity that would like to be a part of DAC, we want you to be in it together as well, because there is a tab on there where on the website where you can fill out a form and send us your information to be a part of the Diabetes Advisory Council of South Carolina. So we'd love to have you.
All right. And can they get all of that information on the inittogethersc.org website, Michelle?
Absolutely. And they can go to contact us if you would like more information, or there is an email address as well, ndpp@dhec.sc.gov. I'm giving both of those because, like Shauna mentioned the last time, we're all kind of working virtually and I don't want anybody to fall through the cracks, but there is a form under contact us. Put your info down there and we can get information to you. Or like Trey, contact Trey, she'll tell us.
Absolutely. All right. Khristian Curry, Michelle Harris, thank you so much for joining us today and for the official launch of the In It Together website, Coping with COVID and In It Together presents Wellness Wednesday. The DAC website launched today. The hub is for patients, providers, employers, life coaches, and more, because we are in it together to prevent diabetes. So excited about this partnership, and just want to urge everyone to definitely take advantage of these resources. Post and share this information out so we can get this message to the masses, because we are in it together. And it takes all of us who know the information to have the information to share it and to support those who need it. Michelle, Khristian, thank you so much for joining us today on Coping with COVID. I appreciate you.
Thank you so much, Trey. We appreciate the opportunity.
Absolutely. So now you know how to get in touch with Michelle and Khristian for the In It Together and DAC website. Now, please go on over to my personal and professional Facebook page, Tailor Made Productions. Please like and share so that you can not only check out Coping with COVID Monday through Saturday at 2 p.m., but you can also get all of your COVID-related updates. Also, don't forget, we're streaming live on the In It Together website. Don't forget to like it, post and share all of the information, because again, we're in it together. Now, tomorrow on Coping with COVID, Sharika Robinson is a civil rights attorney in Charlotte, North Carolina, and Julian Williams is the new VP of Diversity at the University of South Carolina. We're going to talk to them about discrimination, how to know when you're being discriminated against. Is it just you feeling a little sensitive, or is it really discrimination? And what to do and how to report it from the professional standpoint and from the school standpoint. Also, Faith Friday, Pastor Laverne and Veronica Williams from New International Dream Center are going to join us. And then Friday, we'll be live at Rare Variety Cafe, eating and living well so we can be and get in shape when something like COVID hits. I'm Trey Taylor. If you have a story that could help someone cope with COVID, please inbox the Tailor Made Productions page and let's talk about seeing how we can get you on the show. If you have a product or service that can help someone cope with COVID, please email copingwith TreyTaylor@gmail.com. That information is scrolling at the bottom of the page. And let's talk about how you could be a proud sponsor on Coping with COVID, along with DHEC, In It Together, the City of Columbia Office of Business Opportunities, Agape Counseling and Training Center, Palmetto Media Connections, and Columbia Housing Authority. As always, I leave you with a reading from Jesus Calling, and today is August 19th. It says, I continually call you to closeness with me. I know the depth and breadth of your need for me. I can read the emptiness of your thoughts when they wander away from me. I offer rest for your soul as well as refreshment for your mind and body. As you increasingly find fulfillment in me, other pleasures become less important. Knowing me intimately is like having a private well stream of joy within you. This spring flows freely from my throne of grace, so your joy is independent of circumstances. Waiting in my presence keeps you connected to me, aware of all that I offer you. If you feel any deficiency, you need to refocus your attention on me, Jesus says. This is how you trust me in the moments of your life. That's your Jesus Calling for today. Go to JesusCalling.com to get your own personal copy of one of my favorite devotionals. Thank you again so much for joining us on Coping with COVID with Trey Taylor. Until the next time, I wish you peace, blessings. I remind you to wash your hands real good, and please wear your mask.
Coping with COVID is brought to you by the South Carolina Department of Health and Environmental Control. Visit scdhec.gov for an updated list of testing sites and important information on how to protect yourself, your family, and friends from the coronavirus. SCDHEC, healthy people, healthy communities. Also, the City of Columbia Office of Business Opportunities, helping to meet the needs of small, minority, and women-owned businesses in the City of Columbia. Log on to columbiasc.net/OBO. Agape Counseling and Training Center. Call 803-779-2777 for licensed professionals of counselors and social workers helping families, engaged and married couples, and individuals of all ages gain an understanding of all aspects of their life. If you're having a challenge coping with COVID, contact Agape Counseling and Training Center at agapects.com. And Columbia Housing Authority. The agency is looking for stories from former residents of Allen Benedict Court to retain some of the property's rich history. In its 80-year life, Allen Benedict Court has been home to some of the country's elite, including a Grammy Award-winning performer, corporate executives, national television celebrities, a host of doctors, lawyers, and NBA greats. So share your pictures, mementos, and memories at chcares@chasc.org. Coping with COVID, brought to you by the South Carolina Department of Health and Environmental Control, the City of Columbia Office of Business Opportunities, Columbia Housing Authority, Agape Counseling and Training Center, and Palmetto Media Connection.
Coping with